Hello everyone, welcome. Let me introduce my topic, investigating the correlation between oral health and comorbidities. My name is Caroline, I'm a PhD student and dentist with the Department of Restorative Dentistry and Endodontics. My supervisors are Zsolt Lohanai, Beata Keremi, and Iko Zabo. My SMS is Petrona Martinkova. Our statisticians are Sylvia Kishtala and Gergely Akuc. My mission is to reduce the number of comorbidities associated with oral lesions. My vision is to educate the population on the importance of oral health and the impact which it would have on our general health. I have two goals. My first is investigating the prevalence of oral bacteria in cardiovascular samples. My second is investigating the effect of endodontic treatment on inflammatory biomarkers. It's a systematic review and meta-analysis. So cardiovascular disease is responsible for the loss of 18 million lives each year. Periodontitis, which affects up to 50% of the population, is associated with an increased risk of cardiovascular disease. The more severe the periodontitis, the higher the risk of cardiovascular disease. And Porphyromonas, which is an oral pathogenic bacteria, may cause an imbalance of lipid levels, leading to endothelial disruption. And our aim is to determine the prevalence and the risk factor of oral bacteria in samples of adults with cardiovascular disease. Our first clinical question: what is the prevalence of oral bacteria in cardiovascular samples of adults with cardiovascular disease? Our population are adults with cardiovascular disease, and we would like to check oral bacteria in their cardiovascular sample by PCR or culturing methods. And after full data extraction, if possible, we would like to make subgroups which would differentiate the target of oral bacteria or the effect of antibiotic prophylaxis. Our hypothesis is that oral bacteria colonizes in cardiovascular lesions of adults with cardiovascular disease. Our second clinical question: does the bacterial profile in cardiovascular samples differ in adults with or without periodontal disease? Our population are adults with cardiovascular disease, and we have a group with periodontitis and a group without periodontitis. We would like to check and compare the oral bacteria in these two groups in the cardiovascular sample by PCR or culturing methods. And our hypothesis is that in adults with periodontal disease, the bacterial profile of cardiovascular lesions differ. Our third clinical question: does the presence of oral bacteria in oral samples increase the risk of oral bacteria colonizing in cardiovascular lesions? Our population is adults with cardiovascular disease. We have a group with a positive oral bacterial sample and a group with a negative oral bacterial sample. And we would like to check the oral bacteria in the cardiovascular sample by PCR or culturing methods. Our hypothesis is that oral bacteria found in oral samples increases the odds of detecting oral bacteria in cardiovascular lesions. So here's the databases we used and our search key. We initially had 16,260 articles, and we were left with 134. And for the first forest plot, these are just our preliminary results where we investigated the prevalence of Porphyromonas gingivalis in cardiovascular samples of patients with periodontitis or gingivitis. And we also had groups, edentulous and healthy. And usually we would not expect to find Porphyromonas gingivalis in the cardiovascular system. Porphyromonas may initiate or contribute to cardiovascular disease. And our results were calculated with 95% confidence interval. There's high heterogeneity which may be explained by the sample size or the location the cardiovascular samples were taken, such as the aorta or the inferior extremity arteries. And there was a 21% prevalence of Porphyromonas gingivalis in the cardiovascular samples. And we could not reach a conclusion due to the low number of studies in the edentulous and healthy group. And here's the prevalence of P. gingivalis in cardiovascular samples of patients where the periodontal status was not well defined. And there was a 10% prevalence. And we made subgroups, so the prevalence of P. gingivalis in the heart was 8%, coronary artery 29%, aorta showed a prevalence of 17%, and the carotid artery showed a prevalence of 12%. And here we're showing the prevalence in arteries after the aortic bifurcation, but there was not enough studies, unfortunately. And finally, the prevalence of P. gingivalis in arteries not defined by the author. Here's a table with a summary, and the coronary arteries show the highest prevalence at 29%. So some strengths, inclusion and exclusion criteria were always mentioned. Rigorous methodology was described and followed. Subgroup analysis for several conditions. Limitations, CVD diagnosis was not always clear. Antibiotic prophylaxis in some cases was mentioned, but not in others. Individual patient data was not always given, and the results were pooled. Periodontal stages were not well defined. In conclusion, even a small amount of oral pathogenic bacteria found in cardiovascular samples could have a clinical significance. Our data shows that the coronary arteries are more susceptible to P. gingivalis compared to other investigated arteries, and eliminating oral lesions and oral pathogenic bacteria may prevent or slow the progression of CVD. Our implication for practice is to improve interprofessional collaboration, encourage regular dental checkups and treatment. Our implication for research is to evaluate the effect of periodontal treatment in ORCTs for MACE, and also the pathological role of P. gingivalis and others should be investigated further. So we're currently assessing risk of bias, and my second topic is a systematic review and meta-analysis. So an endodontic infection affects up to 87% of the population. Endodontic infections may perpetuate systemic inflammation, increasing inflammatory biomarkers. An elevated HSCRP can predict the likelihood of developing cardiovascular disease. An untreated endodontic infection may potentiate the progression of CVD. So our aim is to determine the level of inflammatory markers in serum before and after endodontic treatment. And our clinical question, how does endodontic treatment affect the levels of inflammatory biomarkers in adults? Our population are adults with endodontic disease. We take a blood sample before and after endodontic treatment, and our outcome, we're looking at inflammatory biomarkers such as HSCRP, interleukin-6, TNF-alpha so far. Maybe we can investigate others later. Our hypothesis is that root canal treatment can effectively reduce the levels of inflammatory biomarkers. And our clinical implication is to increase awareness of the role of the dentist in the prevention of comorbidities. This is our preliminary search key and the databases we used. Our key articles all show a significant reduction in the levels of inflammatory biomarkers after endodontic treatment. And here is our progress. We plan to submit our first topic by May 2024 and our second by September 2024. Thank you for your attention. Let me finish with a quote by Thomas Berger. The art and science of asking questions is the source of all knowledge. Thank you.
how were these cardiovascular samples were taken? How were they taken? Mm-hmm. And do you have any other bacterial or bacteria types to be included other than Porphyromonas?
So all of the cardiovascular samples were taken at a time of planned surgical intervention, and it could have been a dilating or constrictory diagnosis, such as atherosclerosis or aneurysm. And for the second question, yes, we plan to investigate many other oral pathogenic bacteria. It just takes a lot of time because we have so many articles, but yes, we plan to do that.
You said that the limitation of your research is that the periodontal stages are not well defined.
Yeah.
My question is that which specific types of periodontitis were included in your study?
So they were like 99% moderate to severe periodontitis. Yeah. We're trying to make really nice subgroups with mild, moderate, and severe, but we're lacking in articles, so hopefully when we finish data extraction, we can do that nicely.
About the stage of the periodontitis, is treated or it's ongoing, or which phase?
No, so it's not treated. These patients were examined 1 week prior to surgical intervention, and the exclusion criteria in most of the articles is no periodontal treatment at least 1 to 6 months before examination. Yeah.
Okay.
So I assume they would undergo after the cardiovascular surgery.
Do you know why the coronary arteries are more susceptible to Porphyromonas gingivalis?
So as of now, due to our preliminary results, we're still investigating a reason why.
Thank you. Thank you so much.
I would like to ask, you mentioned that you also included individual patient data. I'm not sure which project, but my question is, was it mentioned in the studies, or they sent you to somewhere else on the website?
Yeah, unfortunately a low number mentioned individual patient data, but we do plan on writing to all of the authors to acquire the information that was not given about the individual patient data. It would be really nice to have, yeah.
Did these colonizations in the CV system in any cases cause any infection-related symptoms, or these were asymptomatic in all cases for the patients?
So can you repeat the question?
So these, for the patients where the samples were positive for bacteria, did any of these patients have infection symptoms, or it was asymptomatic in all cases?
No, as far as we know from the studies, no, it was not mentioned.
Could you elaborate what kind of cardiovascular diseases did you investigate?
Yes, so there's in majority 2 types, dilatory, like aneurysms, or constrictory, like atherosclerosis. These are the 2 main groups that we've come across so far.
You mentioned the population is adults, and there was any data about the age when they made the sample sizes?
Yes, so most of the cardiovascular diagnosis would occur in the age group of 50 to 60 years old plus. There was one study which we had to exclude because the age was 20 years old, and yeah, we wanted to make everything homogeneous, and we excluded that study.